Sexually transmitted diseases or infections, known as STDs or STIs, affect many people in New Jersey and across the United States. Even with current policies in place to combat this issue, the number of infections continues to rise. New Jersey offers screenings for STDs at local health departments, but this is not enough. This presentation will present some cost-saving ways to reduce the healthcare burden of sexually transmitted diseases and increase the well-being of New Jersey residents. Syphilis rates have doubled among women, including affecting some pregnant women. Congenital syphilis can cause miscarriages, stillborn babies, and have lasting health problems among babies that survive. The number of congenital syphilis cases in 2017 increased to over 900 from the 2013 data showing 326 cases. Overall, primary and secondary syphilis cases in the United States rose by 76% from 2013 to 2017. The Centers for Disease Control and Prevention reported 570 primary and secondary syphilis cases in New Jersey, a rate of 6.3 to 100,000. According to the Centers for Disease Control and Prevention, many types of sexually transmitted diseases negatively affect the population, such as gonorrhea, herpes, hepatitis, etc. Chlamydia infections remain a top concern. Chlamydia cases equaled 1.7 million nationwide in 2017. In New Jersey, the CDC reported 36,514 cases of chlamydia, a rate of 405.5 to 100,000 in the year 2018. Even more concerning to experts is that chlamydia can be asymptomatic, leading people to believe there is nothing wrong with them. Developing pelvic inflammatory disease, PID, a more severe infection, is an alarming risk factor for women with chlamydia. Primary and secondary syphilis and chlamydia figures rose from the year before. Sexually transmitted diseases affect sexually active individuals of all ages and genders and can affect babies at birth. However, the New Jersey Department of Health said the highest rates are among women ages 15 to 24. Chrisberg also shared concerns about high infection rates occurring with men who have sex with other men. The Centers for Disease Control and Prevention noted that sexually transmitted diseases tend to affect vulnerable populations at higher rates disproportionately. The individuals who suffer from poverty or do not have stable housing and drug users might have reduced STD prevention and care access. The CDC stated that young adult people and men who have sex with other men have decreased condom use. Racial and ethnic minorities have an increased burden from sexually transmitted diseases, and as I spoke of earlier, pregnant women and their babies have unfortunate consequences from STDs. The Centers for Disease Control and Prevention said that in 2018, lifetime STD cost estimates for the United States healthcare system were around $16 billion. They noted that cost estimates do not include STI prevention. What is currently being done in New Jersey to reduce these costs? The Burlington County Health Department has an STD clinic where people can get tested for STDs and gather educational materials. While there is an urgent need for STD testing, the Burlington County Health Department reported closing their testing center in December of 2020 and has yet to reopen it. They blamed COVID-19 for the closure. However, bars, restaurants, gyms, and other businesses are open during the pandemic. Face masks are mandatory in the state, and vaccines for the virus have begun to roll out. Yet, the county is unable to open the STD clinic to allow people to get tested. Even if the STD clinic was open, various barriers like stigma and lack of knowledge about the services or their individual needs for services prevent people from seeking out assistance. The state needs to address the STD issue, take it seriously, and take a more aggressive approach to prevention and treatment measures. If New Jersey wants to reduce costs, burdens, and challenges the population and healthcare system endures because of sexually transmitted diseases, a more aggressive policy needs to be in place for prevention efforts. The state should increase its efforts to reach the target population with engaging information and give compelling reasons to get tested. Many people might not know they're at risk since some sexually transmitted diseases do not have any symptoms or have delayed symptoms. In addition to spreading knowledge, New Jersey should increase people's ability to obtain free condoms. By making small changes, the state can better handle the number of sexually transmitted diseases and help people live healthier lives. New Jersey should take some unique strategies to reach the young population of individuals affected by STDs. There is a requirement in New Jersey public schools to teach safe sex practices in sex education classes, but there is no set curriculum to guide schools. No matter the background or the political affiliation of families, almost all the parents surveyed in the Thrive New Jersey Coalition's 2019 report wanted schools to teach their children about STDs in greater length. Because embarrassment and social stigma can make adolescents and young adults uncomfortable talking about sex, reaching people through video or social media channels should increase knowledge more comfortably. I am proposing New Jersey invest resources to produce engaging videos, memes, and ads and place them in sex education curriculum, social media outlets, and sites frequented by the population affected by sexually transmitted diseases. These locations might include secondary schools for the curriculum and sites such as Facebook, Instagram, YouTube, Twitter, and Snapchat. Teachers can use up-to-date videos and visual aids that express the concern without embarrassing the youth viewing them. Promoting safe sex and vaccines to prevent STDs and testing for sexually transmitted diseases through campaigns would decrease the number of people negatively affected. Spreading knowledge uniquely and excitingly should help eliminate stigmas associated with sex and get the younger generation to talk to each other about ways to stay safe. The most vulnerable to sexually transmitted diseases have a low perceived risk of it happening to them. Getting people to use condoms during sex will reduce the occurrence of sexually transmitted diseases. There are many barriers to getting people to use condoms, such as stigma and embarrassment associated with their purchase or not having access or knowledge to free condom stations. I am proposing that New Jersey increase the number of free condom stations and create a website to request free condoms in the mail. Prime locations for free condoms will be places young adults and vulnerable individuals will see in their daily lives. The local health department should distribute condoms to homeless shelters, college campuses, bathrooms, and other places like bars and nightclubs, including those aimed at serving the LGBTQ+ population. In Washington, D.C., they have a number that people can text that will take them to a website for getting free condoms delivered to their door. New Jersey should implement a program like this. Social media ads will give the state of New Jersey a return on its investment. Spreading awareness and information will help to lower the costs associated with sexually transmitted diseases. Sanders et al. Described a similar campaign geared towards youth smoking cessation. They said that Facebook and Twitter ads increased their government website traffic by 980% at the cost of 63 cents per click. Paracle et al. Reported consistently in reaching a mostly adult audience using social media advertising and campaign strategies. They found it to be a cost-effective approach. While there are various prices to run ads on social media, they are small compared to the costs sexually transmitted diseases are causing on the healthcare system and quality of life. Williams et al. Evaluated the cost of video-based STD interventions and found the net price of approximately $108,000 being cheap and effective compared to typical care costs. They concluded that the use of media in preventing STDs is worth the effort and expense. I am proposing New Jersey double their spending on the cost of free condoms to distribute to a broader range of places that will reach more people. Having access to condoms will eliminate barriers to usage and ultimately significantly impact reducing the number of sexually transmitted diseases. New York City found a similar condom distribution program to be effective and cost-saving. Once people become exposed to more information and better understand the risk factors associated with sexually transmitted diseases, the number of people affected will decrease. By having easy and confidential access to condoms, the number of people using them will increase. These factors will help people live healthier lives and save New Jersey money in the process.